Welcome to PROCURE Health Talks, a webinar specially designed for men affected by prostate cancer and their loved ones. The various topics covered in these webinars are intended to provide reliable information based on the concerns and questions asked to PROCURE healthcare professionals. Let's begin.
Hello, I'm Dr. Malek Meskawi. I'm a urologist at the CIU-SSS du Nord de l'Île de Montréal and the CHUM, and I am happy to talk to you today about prognosis and survival rates in prostate cancer. Prostate cancer is the most common cancer in men. It's the third leading cause of death for all cancers combined in men and women, and 20% of patients who have prostate cancer have received that as a new diagnosis. So there are a lot of questions that patients have on the day that they get diagnosed or during subsequent appointments with their doctors. So here are some of the most common questions. Doctor, am I going to die of prostate cancer? Is my cancer curable? Could I delay my treatment? How many years do I have left to live? So all of these questions are important, and our goal today is to look at all of that and really understand prognosis and survival rates so that we can answer these questions a little more clearly. Now let's talk about survival rates. What do we mean by survival rates? The survival rate is the percentage. It's a piece of statistical data, studies that have been done over large populations, looking at certain stages and types of cancer, and these will show us what is the chance that a patient is going to be alive 5, 10, 15 years after treatment or after diagnosis of that cancer. So that is the definition of a survival rate. Now, for prostate cancer survival rates, there are different stages, and survival rates depend on the disease, the patient, a lot of factors that we're going to look at a little bit later. And it always depends on the disease. That's the most important thing. So just to look at this quickly, for localized prostate cancer, the localized stage means that this is a cancer that is confined to the prostate. The relative survival rate after 5 years is almost 100%. That's great news and very encouraging for our patients. Now, a cancer that is localized in the prostate but is more advanced, so there's a higher risk that this could spread. Even with those factors, there's a good survival rate around 95%. Then when we look at metastatic cancers, and that means that prostate cancer has a good survival rate. When you look at these statistics, even disease that has spread outside the prostate, then we're talking about a stage where it might not be cured, but despite that, the 5-year survival rate is still 50%. That's very important and very encouraging for our patients. So when we look at sort of an overview and we talk about every patient who has prostate cancer, the survival rate overall is around 91%, and that's for patients that have been newly diagnosed with prostate cancer. A patient that has already gotten the diagnosis and has been in treatment for several years, so after a few years of treatment, there is a new idea which is called relative survival. And what that means is I've lived 5 years with this cancer and I'm doing well. How many years more am I going to live? That's what we call conditional or relative survival. So for prostate cancer, if we compare it to another patient, someone in the population who does not have prostate cancer, at 5 years, it's almost 100%. So if you have cancer and you've been in treatment for several years, and 5 years, the relative survival rate is almost 100%. 10 years, it's 98%, and 15 years, it's 95%. So if we look at the data, we can understand that if you have lived with prostate cancer for a few years, your long-term survival chances are a lot higher, and that's also very encouraging. Long-term survival, and let's look at, what do survival statistics look like once you've been diagnosed, once you've been treated? If we talk about early diagnosis, long-term survival means that you're cured, that we can completely cure this disease and it doesn't affect your life. For medium long-term survival, for those more advanced diseases, even if it's advanced, survival, we have very encouraging data. So that means that prostate cancer is a type of cancer that has a good survival rate after many years. What are survival factors? A lot of factors can come into play, and the most important things are the stage of the cancer upon diagnosis. And when we have cancer, what does a stage mean? We're going to talk about that a little more later when we talk about prognosis, but the stage means, is the cancer localized? Is it localized but advanced? Or has it spread to other parts of the body? And especially, other than stage, it depends on the type and the local aggressiveness of the cancer. There are other characteristics of the cancer that can influence survival factors. There's the choice of treatment and the patient's response to the treatment if the patient has been newly diagnosed. So now let's talk about prognosis for prostate cancer. What is a prognosis? The prognosis is an idea that a doctor can give to the patient as far as the progression of the disease. And if we're talking about a treatment, how can the treatment improve the progression, or how could the treatment cure the cancer? In general, that's what we mean when we talk about prognosis. When we talk about prostate cancer, it's one of the cancers that has a really good prognosis. There are many factors that come into play on progression of the disease. So the patient's age, and we know that if someone is diagnosed when they're young and they're at the localized stage, that's the best prognosis. And if someone is diagnosed when they're older with a localized cancer, they have a good prognosis too. But if we have a young person with a cancer that has spread throughout the body, that's not a good prognosis, just as if that person were older and that person gets a diagnosis of a cancer that has spread. Your state of health is also a factor that affects the prognosis, because when we look at the patient's state of health, we can decide on a course of treatment, and we can decide how aggressive the treatment is going to be. What type of treatment are we going to have? The third factor is your PSA, or prostate-specific antigen numbers, and that is a protein secreted by the prostate gland. And this protein, when we're talking about an advanced cancer, the protein is going to be secreted more often. And when we see very aggressive prostate cancer, the PSA level, prostate-specific antigen level, can be totally undetectable. Then we have the Gleason score, which we call the grade. The grade means the local aggressiveness of the cancer. That's what grade means. And it's important to distinguish between the two, between grade and stage, because they're two totally different concepts, and that often leads to confusion. So we've talked about grade, stage, risk of progression, and other factors that can help us decide on the prognosis for the disease's progression in a certain patient. Now I'm going to talk a little bit about the Gleason score, or the local aggressiveness. And in medical terms, this is what we call the grade of the disease. So the grade is between 1 and 5. 1 is a cancer that is not at all aggressive. 5 is very aggressive. One is a cancer that in certain situations we can just keep an eye on it, or in modern terminology, you hear the word indolent cancer. We're going to say level 1 is a cancer that is indolent, level 5 is very aggressive. And what does this mean? It means the behavior of the cells in the prostate. Stage is the idea that we hear a lot about. 1, 2, 3, 4. So you'll often hear, yeah, that person has stage 4, means the cancer can no longer be cured. We call it metastatic, where the cancer has spread throughout the body. Stage means, is the disease just in the prostate? Is it in the prostate and it's gone outside the prostate and invaded the neighboring tissues or organs? Is it in the lymph nodes? That's also involved in the idea of stage. Or has it spread outside the pelvis? Is it in the patient's bones, in their other organs, for example? That's what we mean by stage 1 to 4. And 4 is where the cancer has spread throughout the body, and 1 is where the cancer is confined to the prostate. Now let's talk about progression risk. We have a variety of tools that we use to assess or estimate the risk of progression of the disease, and that plays into our treatment decisions and how we are going to, let's say, give counseling or give advice to that patient. So progression risk is based on the grade, the local aggressiveness, stage, which I just explained, 1 to 4, and the third factor is the PSA level. And when we try to determine progression risk, that helps us make treatment choices and a little bit how we're going to focus the prognosis of that disease. There are 3 progression risk levels, so we call low risk, medium risk, and high risk. So how do we determine this? Really, it's a combination of the 3 factors that I just mentioned. If we have a very aggressive stage, we're going to be talking about a high risk, or if we have an aggressive grade, it's going to be the same thing. So there we have risk, a disease that is going to be high risk. And why is it important to know this? Because as a doctor or as a patient, I can determine together with the patient the treatment plan based on these risks. And these risks also tell us a little bit about the disease's long-term behavior. Once this patient has finished treatment, is there a higher risk that this disease is going to come back in the long term? And we use those various progression risks to determine that. So if we have someone at low risk and they're in a cure phase, someone is at medium risk, they're in a cure phase as well. High risk, they could also be in a cure phase. But when we look at that very high risk, where the disease has become metastatic. There, we're not talking about a cure anymore. We're talking about extending that patient's life and reducing the progression of the disease, but we're not talking about a cure. In addition to progression risk, researchers have developed different tools which are based on data coming from patients who have prostate cancer. There are different tools that are available out there, and I'll name a couple of them here. For example, the CAPRA score, the Parton tables, and the Catan calculation. These are different tools that can help us a little bit to identify the progression of that patient's disease. It's something that is really more, I'll name them here just to keep you up to date on them, because it might be that you see them out there on the internet or in other resources when we're talking about prediction tools, but those are really reserved for your doctor to help to determine what is the best treatment for you according to each risk in each category or each prediction tool. So I would just note that these tools use the same factors that were already used in the table that I had mentioned earlier when I talked about progression risk: stage, PSA level, the grade or the degree of how aggressive the disease is. And they might use other factors like number of samples, patient's age, things like that. But these are tools that help us guide the patient toward a treatment choice. And they also help us guide the patient after the treatment, looking at what the progression of their disease might be. So let's talk a little bit about what happens after diagnosis. So, as you know, localized prostate cancer is a cancer that progresses slowly. And in general, it is not a type of cancer that is really going to affect the patient's life. Or if it does, it's going to take decades in order to have an effect on the patient's life. The treatment for localized cancers, there could be different ways of treating it: surgery, radiation therapy, but treatment for localized prostate cancer is aimed to really cure that disease. Some localized cancers can be aggressive, they can spread even though the patient has been treated, or even though at the outset we saw that this was cancer that was really localized in the prostate. And in some cases, a localized cancer can come back over the long term. And so, despite that treatment, the fact that you've been treated does not exclude the possibility that the patient has to be tracked by their doctor regularly to make sure that the disease isn't coming back. And what does that monitoring consist of? It consists of monitoring their prostate specific antigen. So, as I said, this is secreted by the prostate and give us an idea of, is there residual tissue? Is there a risk of this cancer coming back in the future? Locally advanced cancer, if it is properly treated at the right time, we can cure that cancer. The treatment can cure locally advanced cancer. Locally advanced cancer will be best cured through a variety of approaches. Sometimes one treatment like surgery is not effective. The person may need surgery, radiation, and hormone therapy to cure locally advanced cancer. And with locally advanced cancer, it is at a higher risk of progression in the future, and the patient may need other treatments in order to prolong that patient's survival, and in fact to really, above all, prolong that person's survival and to lower progression risk. Metastatic cancer. So once we're talking about metastatic cancer, it's cancer that is outside of our control, that has spread to the other parts of the body. That metastatic cancer, unfortunately, it is not curable. But does that mean that someone who has metastatic cancer is going to die in the next few years? No, that's not it. As I already said at the start, a patient who has prostate cancer with metastatic cancer can live for a number of years. So 50% of those patients are going to live 5 years easily with treatment. So the stage where metastatic cancer, when we do see that patients will die, is called castration-resistant cancer. And what do we mean by that? Castration-resistant cancer means prostate cancer is a type of cancer that is fed by hormones like testosterone. So when we look at metastatic cancer, hormone therapy where we suppress testosterone, it's required at that stage. And at that time, in certain cases, despite that treatment to suppress testosterone, patients may still have cancer activity. And in that situation, we call it castration-resistant cancer. And unfortunately, at that phase, that is end-stage prostate cancer. And that is the stage where we see that patients dying of prostate cancer. Once we're looking at metastatic cancer, then we're not looking just at hormone therapy, we're looking at chemotherapy. And at that time, patients are going to have the highest level of symptoms because they have metastases. They may have pain, sometimes neurological symptoms, because they have fractures. And that is the stage where we see it requires the highest level of attention from patients, from doctors, from their urologist, oncologist, or the patient's family doctor. Now let's talk a little bit about the prognosis for advanced cancer. Nearly 25 to 30% of cancers reoccur. Prostate cancers reoccur after the initial treatment. And after a reoccurrence, the potential for a cure depends on where that reoccurrence is. If it's local, so in the pelvic region, because the cancer is in that location, we can still envision that it could be cured. And if that reoccurrence is distant, in some cases, the cancer can't be cured. Actually, if that recurrence is distant, the cancer is not curable. It's important for patients to know a significant number, 10% of patients, have metastases at their initial diagnosis. Why is that? Because as you know, nearly all patients who are diagnosed with prostate cancer are asymptomatic, and they receive this diagnosis following a elevated prostate-specific antigen test. So those results mean that their family doctor goes looking for the cause of that result, and they are then diagnosed with prostate cancer. So for that reason, if we have localized or locally advanced cancer, nearly all patients are asymptomatic. As I said, 10% have metastases at their initial diagnosis, and some of those have symptoms, and some of those patients don't. So even with that metastatic diagnosis, their survival rate can be higher than 50%. As I said, metastatic cancer can present in various ways. So that's a bit about survival and prognosis for prostate cancer. And it does happen fairly frequently that a newly diagnosed patient will ask the question, "Doctor, how many years do I have to live with this cancer diagnosis?" And the answer really is, it depends on the status of the disease, the stage, how aggressive the disease is. So there isn't just one answer to that question. But just to mention that comparatively, prostate cancer has a very good prognosis. That doesn't mean that you don't need to pay attention to it, but it means that if the patient is treated and if he follows his doctor's recommendations, the prognosis is good. So to summarize, just to give you a few messages and takeaways, living with prostate cancer, it's a type of cancer that grows slowly. Living with this type of cancer, we see patients living 20, 30 years with prostate cancer, either under treatment or with no treatment. So learning as much as you can about the disease is the most important thing. That's the first thing. Second thing, there is always treatment available at the various stages of the disease. With research, treatments are becoming more and more effective. And the most important thing, a cancer diagnosis can affect the patient and his family. So learning to live with prostate cancer, learning as much as you can about the disease is the most important thing, because prostate cancer is not something that you live for 1, 2, 3 years with. Sometimes we see patients living 10 to 15 years. So it's a type of cancer that is really different than other types. Just to wrap up with a question. And if I have prostate cancer, to ask my doctor, how can I improve my prognosis and my quality of life? I think that the most important thing, number one, is to keep in good physical health, because as we know, cancer treatments can affect other parts of the body, not just the cancer, can affect your overall state of health. So stay physically active, eat a healthy diet. Those are important. And really get to know as much as you can about the disease, understand it well, don't underestimate it. That's really important for improving your quality of life, and I think it gets us out of the mindset that we have cancer, and in some patients, I think that can lead to a pretty negative emotional state. And just to mention, like as you know, the PROCURE Foundation has a support line. And when you have cancer, it's really important to talk about it, to communicate, and to ask questions, ask for support from people who have experience or expertise with that type of cancer, with prostate cancer. So each patient who's diagnosed with prostate cancer, I encourage them to call the PROCURE support line. That's 1-855-899-2873. Thank you, and have a great rest of your day.
We warmly thank our experts and our partners for making this webinar possible. To find out more about the tools and resources available to you, or to make a donation, visit procure.ca. Thank you for your support.